My name's Hugh Brewster. I'm the Executive Director of Transforming Faces in Toronto, and I'm really delighted that you've joined us for what is, I think I tweeted out earlier last week, just the topic that's at the top of all of our agendas, what we're thinking about as we plan, what we're worried about as we think about our colleagues, but how do we resume care? And so the topic today, cleft surgery and comprehensive cleft care in the COVID-19 era. I think it's probably a bit of a work in progress as opposed to the final statement on this, I think, as Erin and I were talking this morning about case counts here in Toronto. We are sort of more into closer to a lockdown, I think more similar to the UK right now. So we are riding this wave, but we recognize just off the top that this is a really difficult topic, and we're really grateful that you are calling in, irrespective of all the challenges that you might be facing in your part of the world. But anyway, on behalf of the Circle of Cleft Professionals, welcome, and we're glad you're here. And I'll just, as people continue to filter in, I will pass the camera over to my colleague Niti, who will take us a little bit through the agenda and what we'll be doing today.
Hi, everyone. Thank you so much for joining in, and welcome to our 20th Circle of Cleft Professionals webinar. A few tips on using Zoom to make the most of this webinar experience. Please display your full name or type it out here on chat, because it helps us to know who we are meeting with today and makes it far more easier to interact with each other. It would be helpful if you could please keep yourself on mute through the presentation to avoid any background noise. Zoom has these reaction buttons that you can use at the bottom of your screen. Always makes it more interesting, so feel free to try it out right now if you like. You can also use the Zoom chat to send across comments or ask questions while Erin's presentation is on. After the panel discussion is done, we'll invite you to ask questions. You can either type out your questions using the chat box, or you can directly ask questions by unmuting yourself. So this is how we will proceed today. We will begin with a short COCP update, followed by the main presentation by Erin Stieber that will last for about 25 minutes, to be followed by questions and discussion for the remaining half hour or so. So overall, this webinar is planned for an hour. We have a really interesting webinar coming up next month on the 10th of December, where we have leaders from several cleft organizations coming together to talk about international treatment standards. Stay tuned to hear more about this World Cleft Coalition webinar from Hugh at the end of this webinar. So what are the objectives of COCP? Our aim is to facilitate networking and collaboration amongst cleft professionals to communicate impact and the learning that's happening within cleft care, and that will in turn support the growth of local teams in implementing comprehensive cleft care. We now have 397 members in our COCP community belonging to 12 plus specialties within cleft care who have joined us from 59 different countries across 6 continents. The COCP includes professionals from across all CCC specialties, including nutritionists, psychologists, social workers, nurses, and so on. A majority of our members, as you can see, are surgeons, speech therapists, and cleft charity leaders. We are growing larger as a community. These are the 59 countries around the world that all of our members come from. We would love to invite more CCC professionals into our community. So if you know someone who might benefit from or would be interested in joining the COCP, please invite them to apply for membership through our website. A shout out and thank you to the 10 international charity organizations from around the world, all of who are invested in supporting comprehensive cleft care in low and middle income countries. And now I invite you to introduce Erin, our panelist for today.
Well, thanks, Niti. And yeah, it's exciting to see some of the growth of people, especially during this pandemic, who are keen on learning from one another and have a real interest in supporting comprehensive cleft care in low and middle income country contexts. So today, I'm delighted to have for the first time, Erin Stieber, Senior Vice President of Programs at SmileTrain. SmileTrain obviously is headquartered in New York, but I think Erin is joining us from Washington today. And you know, as we talked about, this is something that is just a going concern. The context changes every day, and with SmileTrain's huge network, obviously they're seeing some of these trends in the micro sense and also macro that are moving forward and changing as the COVID-19 pandemic continues to unroll. So While this pandemic has postponed cleft surgeries and in-person care, surgical care and comprehensive cleft care services are now gradually resuming around the world, bringing urgently needed treatment to thousands of vulnerable patients. So this webinar will feature a discussion of the challenges that Smile Train partners faced at the outset of the COVID-19 pandemic, and also some of the strategies providers have used to continue supporting patients in the resumption of essential cleft treatment amidst the landscape of COVID-19. So we're delighted to have Erin join us. She joined Smile Train in 2013. She's the Senior Vice President of Programs. She has more than 10 years of experience working with cleft lip and palate surgical programs around the world. And she leads Smile Train's programmatic strategy and innovative initiatives in education, training, research, and comprehensive cleft care. It's a wonder that she even gets any sleep with that huge portfolio. But she's here today, got up early, and we're delighted to have her. Erin, please take it away. What should we know about resuming care?
Thanks so much, Hugh. It's fantastic to be on this call with all of you and see so many friends and colleagues from around the world. So I'm really thrilled that everyone was able to join, and I'm looking forward to a really good discussion as well. I'm going to highlight globally the trends that we are seeing, the work that we've done to try and be responsive to the needs of our partners and patients around the world. But obviously all of you are, so many of you are on the front lines of this work and have an even closer perspective. So I think we'll have a really strong discussion as well. So as you said, I'm Erin Stieber. I'm the Senior Vice President of Programs at Smile Train, and I'm really here representing all of our global partners and the patients that we're helping around the world. And it seemed to make sense at the beginning to give a little overview of the current state of COVID and cleft surgery and comprehensive care. Again, most of you are living this, but I think with it changing so rapidly, it's worth highlighting this. So this is a map I'm sure some of you have seen. It's obviously a very global pandemic. This is a screenshot of current cases globally, growing certainly by the day. We seem to be in the third wave, and cases are growing rapidly. So this is, I think in the beginning, all of us wondered in some ways how long we would have to wait this out. But I think what's become abundantly clear, in particular over the recent months, is that this cannot be waited out, in particular for cleft children and others who have essential treatment needs. And we really need to figure out how to live with it and work within it. So if you can go to the next slide. This is just another representation of where we are now. I think this is particularly interesting. It's a map of COVID deaths. The map of cases is not dissimilar in terms of its geographic distribution, but given the population size in Africa and Asia and the relatively small numbers there, you query if transmission is lower there or if this is representative of limited testing. And being aware of those things obviously has to play into the COVID response that we're all seeing around the world. Next slide. So I did a bit of a lit review to kind of see where we are now, and not surprisingly, I think as you see me flip through the next few slides, you'll see there's relatively little information about the state of treatment for conditions in LMICs. There's a ton from the US and relatively little information about cleft surgery, let alone comprehensive care in the published literature. Though thankfully, as I'll show later, there's a decent amount of guidance coming out. So McKinsey actually did a big survey of US hospitals, which has some fairly comprehensive information showing just the significant decrease in OR cases that are being treated, which should not be surprising to any of us who are familiar in this space. If you can click to the next slide. They also tried to do some initial modeling of how long it could take providers to work through the surgical backlog that we're going to see. And this was modeling for just several months in this year. So again, when we think about if and how we restart cases, I think we also have to be very cognizant of the people that need care and the real risks of the potential for there being a significant backlog that delays access to care and in particular for cleft access to timely care. If you can go to the next slide. there were some modeling that had been done to look at operative volume for other surgical conditions. There was, as you can see here, in the first few months, there was a research study tracking cardiac surgical decline. If you can go to the next slide, the orthopedic community in the US and around the world has come together and done some modeling around the backlog of surgical cases that they're seeing grow rapidly as orthopedic surgeries are delayed. And if you go to the next slide, again, this is a similar backlog modeling of cataract surgery. This again is in the US. There was a good global analysis, if you go to the next slide, of the impact on cancer treatments. I've heard from members of our MAB who work in institutions treating cancer patients and others that like many other conditions, this is a big concern they have. There's a lack of patient presentation across the board and a real risk, again, that surgeries won't be provided when they are needed. And then we'll see a backlog. If you can go to the next slide. I think this one is particularly interesting. This study, again, is focused on the US, but I think when we see these percentages, and again, many of you are living this, when we understand what the real gaps are in providers around the world being able to provide safe, high quality care. And in COVID, that means care that is safe, not only for their patients, but for them, where they are capable of doing everything reasonably possible to protect themselves. We can see that there are massive barriers, and Smile Train has been seeing and trying to respond to a number of these. So obviously there are shortages in workforce, bed availability as we see COVID patients needing space in the hospitals, capacity obviously in the operating rooms, COVID-19 testing ability, and this again is a US study, but I think when we look at availability of testing globally, there are just massive gaps in some areas, which require providers to take different treatment approaches than when COVID testing is available. PPE shortages, only 24% of respondents noted that here. That number is massively higher in the developing world, where access to PPE is more limited and hospitals don't have the resources to provide it. Access to outpatient visits or turnover times, and then limited patient demand, again, is something that we've been seeing. If you can go to the next slide, please. So one of the other things I just wanted to highlight, because I think it's important within this space, again, this is impacting all aspects of cleft care and training, speech therapy, anything that requires a clinical participation or rotation is being impacted, but certainly surgical training is where there's the most detailed data available. So there are some studies, again, this is on cardiothoracic training in the UK, and you can see in particular in E and D and see just a massive decrease in the number of hands-on opportunities that trainees have been getting during COVID. Next slide. Similarly, you can see the decreases across surgical trainees. This again is an ACS study looking at the pandemic's impact on clinical care. And then if you can go to the next slide, this is another study and just shows trainees reporting they're spending more time, surgical trainees reporting they're spending more time in the emergency department, more time in the ICU. They're being reassigned to non-surgical work. They're getting reduced outpatient experience and reduced inpatient experience. So again, as we consider a backlog of cases, should we not react quickly enough, it's concerning to also think about for surgeons and other cleft care professionals, a real delay in trainings. If you go to the next slide. This is just one more showing the number of hands-on interactions cardiovascular trainees in Peru are getting, and I think really represents something that we need to all be aware of as we think about training in the coming years. If you can go to the next slide, please. So while there's relatively little scholarly literature, and I would use this as a call to action to everyone on this call, some of you who I've seen have published on this already, and I'll be touching on a few of those papers, but I think there is a real opportunity in the space to, as a community, do more to publish and really show the needs and the circumstances in this space. If you can go to the next slide, these are a few of the types of guidelines that have been coming out. There are certainly guidelines around the world on surgical readiness. When do we resume surgery? How do we do it safely? The ACS, guidance, which many of the local, I understand many countries have based their guidance on, looks at patient-related COVID-19, PPE, facility infection control, rate tracking, publicly available data, process and facility-related procedures, and then making publicly available information and data. ACPA has obviously released a number of statements. Our teams have been engaged around the world in working with surgical societies and others to help come up with guidelines too. So as time goes on, and I think there was a big push in the very beginning of this crisis for groups to develop guidelines, we're seeing more and more be available. If you can go to the next slide. I think one of the other very important things for all of us to consider, and again, this is more focused on surgery, this metric, but certainly it is something we can apply in some ways, I think, to non-surgical conditions. I think there is still outside of this community a misperception, as I think you all know, about the benefits of cleft surgery outside of a patient's transformation of their appearance. There's quite a lot of data available about optimal times of treating patients and risks if patients are not treated. So there's a amidst checklist that was put out by ACS, and really I think is an interesting metric to score whether or not we should be considering treating patients during this time. It considers whether or not patients undergoing surgery would be at an increased risk of postoperative problems if they have COVID-19. That's an important thing to consider. There's obviously quite a bit of data coming out showing the risk of surgically treating a COVID positive patient and the risk of poor outcomes. Thankfully, that risk seems to be quite low for cleft patients. The second, one of the other factors is whether operations routinely require an ICU stay or require other currently scarce hospital resources. And that may be generally anesthesia or other resources. And then is there an increased risk for spreading the virus to the healthcare team through things like general anesthesia, which of course for cleft we know there is. And then how effective are non-surgical options? So all the factors are rated, and what we found is that for calculations of a otherwise healthy cleft affected child at the time they should be treated around or under age 1, the scores are generally towards the middle or more into the green area of this chart. So I think that, there are guidelines like this. It will be interesting to see how they change as the pandemic continues. If you can go to the next slide, please. I think some of the authors of this are on the call. I don't know if Gareth was on the call or Felicity Mahendley. I think I saw you, who's on our medical advisory board, but there's been some really interesting guidance here as well on treatment during COVID. And again, I think it's important for this community for there to be guidance, but also information showing the essential need of cleft treatment, even during the pandemic, to ensure optimal outcomes for children with cleft. And again, lip nose revisions obviously are probably not things that should be prioritized during this time, but primary cleft surgeries, ear tubes. There are a number of procedures where if they're not performed in a timely manner, the outcomes are unlikely to be as good. So with all of that said, I wanted to flip to the next slide and talk a little bit about what we've been doing at Smile Train to try and empower our partners and keep them safe and ensure care is available for our patients. So this is a protocol that was put together by our medical advisory board. I've just copied the first page here. It pulls many of the similar themes from some of the other global surgery checklists, looking at really what needs to be available for cleft surgeries to reopen. It focuses quite a lot, I think, as it should, on local regulations. At this point in many, if not most or all parts of the world, there are now local regulations about surgical care, about emergency surgical care, and then elective surgical care, and really talks about whether or not a hospital can treat all patients requiring hospitalizations without resorting to crisis standards of care. And I think that's a very important point. As hospitals get back into crisis standards of care, as we're seeing in the United States right now and around the world, I think this becomes a very fluid discussion about what patients we're treating as we consider the other needs in the system. Case prioritization, looking at the amidst guidelines again, postponement of non-urgent procedures, and et cetera. COVID-19 testing, both for staff and for patients, PPE, things like that. So we've put together this global guideline, but if you can flip to the next slide. Many of our local medical advisory boards and teams and partner providers have put together quite a lot of guidelines as well. These are some examples from our team in Mexico. Many of these local guidelines cover not only surgery, but essential COVID guidelines or precautions for other types of treatment. Our Mexico team considers nasoendoscopy, speech therapy. So there's quite a lot of data, and these are in existence for many of our countries and regions around the world. I think the Indian one is possibly 40 or 50 pages long. So they really vary, and they try to take into account the local context. And India, has the red, yellow, green system. There are local systems that have been put together by the governments, and these are all harmonious with those. If you could flip to the next slide. So talking a little bit about what we have done thus far and are committed to continuing to do as this pandemic continues. We really rapidly engaged with our global staff and medical leaders around the world as this was happening, and immediately began to do what we could to support patients. PPE was relatively scarce. And very early on in the early stages of this pandemic, we began efforts to source available PPE for our partners around the world. We began to provide funding for COVID testing. We've donated quite a lot of equipment over the years, from pulse oximeters to pediatric ventilators, anesthesia machines, and we ramped up distribution of some equipment. We were providing support for supplies, whether that was, filters for the hospitals, and anesthesia machines, whether that was disinfectants to help sterilize ORs and other areas of the hospital, hand sanitizer, masks for patients to prevent contracting and transmitting COVID. We put together a series of hand washing stations at hospitals across Africa. So we did quite a lot to try and get supplies into people's hands. Obviously, again, I mentioned hospital sterilization costs, increased facility costs for things like patients having a private room or a room where they were not at risk of transmitting or contracting the virus following their COVID test, but before they went in for treatment. Patient and family support, obviously, having someone take an incredibly crowded bus to the hospital has significantly increased risks that it did not have before. So providing safe patient and family transport and lodging around treatment time. And then two other significant investments that I'm going to talk about a bit more are the investments we've made in telemedicine and the investments we've made in education and training. So that I think you mentioned in the beginning, so many people are excited to join this webinar and these types of webinars. And I think that certainly seems true for providers around the world wanting additional ENT. And if you look at the breakdown of these regions, our regions, we've had some global funding, whether it's global equipment we've distributed globally, whether it is translation of essential guidelines into local languages for providers and patients, or et cetera. But then looking at these areas, Asia, Americas, and Europe and Africa, given the volume of patients and partners that we have in these regions, this is relatively in line with what we're doing, with the recognition that I think the Americas and Europe programs have been a bit slower to get restarted. And so our investments there haven't been necessarily as high as the other regions. If you can go to the next slide. This is a representation of what we're seeing year over year. So the blue numbers are January to October 2019. And then the orange numbers are what we've seen January to October 2020. And if you think back to one of the earlier bar charts I was showing with the decreased percentages in the United States, and then, you know, I think the expected growth of programs, that's in line with what we've seen. So there's obviously, if you look at the gap between the orange and blue surgeries, there's obviously a number of patients who normally would have received treatment at Smile Train Partners during this time period that have not presented for surgery, have not been able to get surgery, are on a list. So there's quite a lot that needs to happen. But there's also, I think we're quite proud of the work that our partners have been doing. And you can see as we get to June and July, and we've really been able to get resources into people's hands, and hospitals have had the guidance they needed to start opening up. For October 2020, we were up to 87% of the October 2019 number. And our partners have resumed cleft treatment in more than 55 countries. If you can go to the next slide. I think it's also important to talk about our CCC growth. Obviously, we provide support for CCC services to many of our partners around the world. This graph tracks the CCC treatments that we're collecting in Smile Train Express, our proprietary medical database. So it's a smaller metric, but I think one we can track more consistently, looking at the number of patients that are being treated. And what we've seen, I think what we're proud to see thus far, is that we've been able to really sustain that CCC growth and treatment during the pandemic during 2020. Obviously 2020 in the slide, the year is not yet closed, but what we're really seeing is that through offering telemedicine support with clear guidance, we've been able to really pivot and make sure that our partners are able to provide services and that our patients are able to access it. And that's taken quite a lot of forms. We've provided stipends or cards for patients and families to access Wi-Fi. You know, there have been a lot of potential gaps in telehealth for patients, especially during this pandemic and with the economic crisis that it's necessitating. But we've really been trying to ensure that when in-person care is not available, particularly for nutrition consultations or at times speech therapy, things that can be provided over telehealth, that we're supporting that. If you go to the next slide, again, this is back to surgical treatments now as captured in STX. This is age groups at time of treatment in 2019 on the top versus 2020 in the bottom. You know, you can see that the first 3 months looked very similar to the first 3 months of the year before, but what you can see as we move to the next chart is just a real increase in the number of, there are fewer treatments, obviously, if you look at the line on, or the numbers on the left, but what we're seeing is an increase in patients under 2 years of age, and a much higher proportion of those patients being treated as we are prioritizing, our partners are prioritizing cases per our COVID guidelines. So you can go to the next slide. This chart has a very similar, you know, indicates similarly. You can see the first 3 months looking somewhat similar to the year to 2019, but then as the pandemic continued and we're providing more guidance to our partners, we do have some partners that are providing alveolar bone grafts and other surgeries at this time, but what we're seeing is that there's a real obvious prioritization of primary surgery. If you can flip to the next slide. So as I mentioned, we've really been trying to use this time, and I'm thrilled to have the opportunity to speak to all of you. I haven't been presenting on any of these webinars that are shown here. It's been all of our medical professionals leading those, but thrilled to be chatting with all of you today about that work. We've really, it's been amazing, the leadership that our partners and our local staff and others have shown in finding ways to make essential education and training resources available. The demand has just been immense for this type of information during the pandemic. And our global teams have convened more than 120 educational webinars with more than 1,000 distinct medical professionals participating in more than 65 countries. And there's been a massive range of topics covered: comprehensive cleft care in all its forms, including nutrition, neonatal care or assessment and treatment as needed immediately after birth, pre-surgical infant orthopedics, speech, orthodontics, genetics, research, anesthesia, nursing, and then cleft surgery, so the technical aspects of cleft surgery, and then, as we're discussing today, how to be active in the COVID and cleft surgery environment. If you can flip to the next page or next slide. As some of you may be aware, we have had the opportunity to take on the operations of Simula Medical. This was announced, I believe, last week. And so, as we continue to grow ENT programs and education and training opportunities, I think it's becoming apparent in this COVID space how absolutely important it is that there be virtual training opportunities. And as we see fewer and fewer trainees in all of the charts I showed earlier, getting access to time in the OR, to time treating patients, it's really essential that we have simulation resources available as well. So this shows just two of the Simula devices, a unilateral cleft lip and a cleft palate device. And we're really excited to be integrating these into our global ENT strategy for our global partners and continuing to offer them to medical institutions and others in the cleft training space. If you can go to the next slide. This speaks a bit more about telehealth for comprehensive cleft care. Again, I showed a slide earlier, CCC numbers and how telehealth has been able to support that. We've provided more than 11,500 sessions of telehealth to more than 7,500 patients, and just have a wide range of partners across more than 40 countries. And I think, as I'm sure all of you providers have seen, I've just heard from our partners about this, but that there's just panic for families that are having children born during this pandemic. There's so much stress around the economy and personal health and family health, and then when they have a child with a cleft and there may not be going to the hospital with them, it may no longer be an option. So the need for telehealth to really make sure that families are empowered, that they're being supported, that they're being guided through this process even during COVID, and have a perspective and understanding of what their child's needs are, and then this connection to providers during the pandemic is really important. And this is just an image of one of many we've seen showing provider and parent and patient engagement during the pandemic. If you can go to the next slide. So what we're seeing here, this is just another example of how we've been working to provide that support network that's so important and even more critical during COVID. So with our partner GSK Consumer Health, which is in a 5-year partnership with us at Smile Train, they've been a fantastic partner. We've been doing a lot of work, and one of the things we've done is launching a toll-free hotline for patients with cleft and their families. And this was launched in 2019, but what we're seeing is it's just become even critically more important during COVID as people are looking for support and resources. You can see just a bit of information here, the number of calls to the number. This is our wonderful hotline attendant who has been working out of her home since the pandemic and really working morning, noon, and night to be available to families in need, and be a constant, point of support for them, but also to do all of the work linking them to the providers that they need to help them. So we're starting to scale these, working to scale these in other countries, given how successful this resource has been. If you can go to the next slide. This is just another example. This is actually something that's been put together by one of our partners, Dr. Sesnia. And again, as we talk about the need for parents and families to get support and to feel supported, telehealth and readily available information on YouTube and elsewhere has been critically important to them. These videos were accessed thousands of times in just the first few days they were posted. So we've been really proud of our partners' work. We've been trying to amplify it and support it however we can. One of the other things we've done is provided, I don't have the stats about this on here, but we've been providing a bi-monthly, sometimes weekly email to our broad network of partners highlighting studies, webinars, any information and resources like this that they can use to continue doing the safest and highest quality treatment during COVID and make available to the families and patients that they're working with. If you can go to the next slide. So again, I think, and I'm sure we all think about this regularly, but the reason we're all doing this again is for the patients. We're trying to make sure they have safe care. We're trying to keep ourselves safe, in part so that we can continue to provide them care. I'm just continue to be so impressed with all of our partners and all of the Cleft professionals doing this work around the world, and the resilience that the patients and families have. So this is one of the babies that was born in Brazil during the COVID pandemic, suffered from malnutrition early on, had many telehealth consultations with one of our nutritionists at APAC in Brazil, and went on as the country reopened to safely receive cleft surgery. And I think the gratitude statement from Karen, his mother, is the appropriate thing to leave everyone with as I finish this presentation. So I hope that was helpful and informative, and I'll turn it back over to Hugh.
Thank you, Erin. Fantastic. Action-packed. Lots of data there for us to absorb. So I'll give everyone a second just to consider. Erin has left us with a lovely amount of time to be able to discuss what does this mean for our own context. So I see Tim clapping there. Well done, Erin. You got a clap from anyone else from the reaction button. Feel free. They're still along the bottom of Zoom. You can put in. I can put a little heart there for Erin also. As you think about this, you've got a couple options. Think about your own context. Think about what questions you have, either for Erin or for Smile Train in general. Think about how else we could move some of these discussions forward in this really pressing topic. And so your options are, you could type your question into the chat, or just indicate that you'd like to ask a question directly. It's great to hear from other people on the call as well. So feel free to turn on your camera. I'll invite you just so we can all know who you're, just when you start your question, if you could just name where you're calling from and your name, that'd be great, so we can understand your context a little bit better as we move forward. So I'll open the floor for any questions or comments about Erin's presentation and about this, this idea of resuming care amidst the pandemic.
Here, I don't know if I may.
The floor acknowledges Ruben from Virginia Beach.
Good morning, good afternoon, good evening, everybody. Erin, wonderful presentation. Thank you so much for sharing so much, and really congratulations to you and the Smile Train team around the world for, again, the just example that even with the difficulties of COVID-19, we don't have to just lay idle. I mean, there are ways to actually engage, and I think it's a true testimony to that. The other thing I wanted to celebrate was your agreement with Similar. I mean, this is an entity that has put some really good efforts into simulation, and now with your support, they really have the opportunity to have access to a broad network and to grow simulation efforts around the world. So my question to you, Erin, because how would we? Because obviously we want to continue to do that. Throughout any other opportunity and forum. So what would be the best way to continue to engage and to work with you and Similar to advance simulation?
Yeah, hi, Ruben. Do I hear your daughter in the background?
I have a sick daughter at home, so anyway, she's here. But obviously this is, I see this as a wonderful opportunity for organizations to, we all are hoping to advance training, but to continue to actually create and even coordinate some efforts. So anyway, once again, thanks and congratulations, Erin.
Thank you, Ruben. It's so good to see you and your beautiful daughter, who's getting so big. Yeah, thank you so much. I think we're really passionate about Similar. That's one of the reasons we're excited about moving it forward. And I think your spot on. There's going to be a need for all of us to do everything we can to integrate it into our training programs. You know, I think it's something that we're really committed to. It will be continue to be available to anyone that wants to use it. You can just reach out to Gian, and he's going to be coordinating everything. He was previously their sales manager, and their entire team at Toronto, all the production associates and Gian will be staying on. So yeah, we're thrilled to continue to make those available to people. I know they're going into a lockdown in Toronto soon, so they may be producing them from their homes for the time being, but we're very committed to that. The other thing I would highlight, and one of the things that we're excited about, is really growing that range. I think, you know, they've done incredible work on the unilateral lip and the palate, and I know there's a bilateral lip and palate that will hopefully be to market soon. But I think there's a lot more that we can do to grow those simulation resources, whether we're looking at you know, pharyngeal flaps or other types of you know, speech surgeries, for want of a better word, whether we're looking at fistula, alveolar bone graft. And so we're also really excited to try and develop those resources. So if anyone has ideas or thoughts on what we should do, work with the team to do next, we'd be eager to hear those too. But yeah, Ruben, we're very happy to continue to make those available to you and all the other providers around the world.
Thanks, Erin, and congratulations again. And thanks.
Thanks, Ruben. Thanks, Erin. And it's a late breaking development last week. So if you hadn't seen that, there is maybe we can post a link to the press release. But the group out of Sick Kids Toronto that have been working on the simulating kits, that's a new development for Smile Training. Congratulations, Erin. Other questions, things that came up top of mind for you?
If I can chime in, since
Sure.
you know, and maybe prompt some. I mean, one of the things that we've been surveying our partners on an ongoing basis, probably more than they would like us to, and also getting a lot of anecdotal information from our medical advisory board committee members and from our staff around the world and obviously our partners. But you know, I think as this evolves, it's going to be really helpful for us to continue to understand what are the gaps that you're feeling in surgery, but also across comprehensive care, where I think, you know, we all have significant attention, but the scholarly literature and others have maybe paid less attention, but it's obviously essential. So I think if anyone has any thoughts, feel free to share them, but also I think keeping that line of communication open so that we really understand, particularly in LMICs, what the gaps are, so that we can all work together and try and fill them.
Thanks, Erin. A question's come in from Trina Sweeney, SLP from Dublin. What percentage of your telehealth sessions have had disruptions because of connectivity or poor access? You know, what's your thought? And this again could be for the whole group also, but Erin, starting with you, what's the impact of connectivity challenges?
Yeah, so I don't know if I have an actual percentage. It's not one of the things we've been tracking in our forms, though we know, I know just from trying to connect with our staff and partners around the world, where there'll be an internet outage or a power outage or different things that can really limit connectivity, that's certainly part of it. Additionally, I know some of our sessions are being recorded, and there are things that require some level of bandwidth as well. I think there's been less, from what I can tell, less an issue of disruption and more an issue of access in the LMICs where we work. I think, you know, the disruptions can be dealt with, but if someone doesn't have a device or can't afford the minutes to participate in a session or doesn't have internet, it can be a real barrier. So figuring out how to combat those challenges through grants, through stipends, you know, it has been probably the biggest challenge that we've faced, and where we've tried to really make the biggest difference.
Thanks, Erin. And that, for those of you who were aware, that was a huge topic during our Solutions for Comprehensive Cleft Care conference in September, looking at different strategies. And there are some COCP resources online about people thinking through how to access technology. Basically, it sounds like, Erin, for everybody around the world, it's a work in progress, right? There's some examples of promising ideas. I think we're still a ways away from saying this is a key solution that can work everywhere, but definitely a very important topic. We see from Dr. Felicity Mahendale. Thanks, Erin. A wonderful summary of how rapidly everyone has had to adapt to COVID, and a huge amount of work that's underpinned keeping global cleft care as accessible and as safe as possible globally. So more of a comment than a question, but just an encouragement, I think, along this way. Erin, one thing that you mentioned in particular was this stress of a family, you know, in the midst of a pandemic where potentially your ability to earn a living has changed, your ability to get around town has changed, and then you have a child on top of that who's born with a cleft lip and palate. What would you say, and this is again to the group, you know, are the most promising practices around trying to alleviate some of that stress, you know, which is really can almost feel overwhelming. I mean, gave birth during a pandemic to begin with, but then have a child with an exceptionality, you know, what have you learned, or what are you thinking about?
Yeah, no, it's heartbreaking. I mean, it's you know, impossible in some ways to wrap your brain around, and as a situation being felt by so many people. I think, first of all, I think having that consistent contact, I think even if surgery is not available immediately, having an expert or you know, a partner in some ways that they can talk to and that can help assure them that it will be okay, provide them with initial telehealth guidance around nutrition or other resources, and really yeah, provide them the support they need and guide them through the process. I think that's always important. I think that's even more important during COVID. And so whether it's through our toll-free line or Cleft Center coordinators or nutritionists that are doing initial consultations with families, I think our network has just done an incredible job, and I'm sure everyone in the Cleft community does, of just being available, of having their cell phone on all the time and being available to these families, and giving them support and guidance. So I would say, I think number one, that's probably the most important thing, and I think just speaks to how important it is that people are available year round to take care of these families, even if they're not going to have surgery for 3 months or 6 months. Having that ongoing support is essential. And then I think the other thing is they're obviously, you know, many families are in a much different economic circumstance than they even were before, when their circumstances were tenuous. So I think we've really been ramping up our grant support around things like lodging during treatment, food, transport, stipends for internet access, for example. I mean, the smallest things that could have been a barrier before are becoming even more significant. We've provided some, you know, just food support to our families as well, particularly for patients that were in nutrition programs. So I think being aware of and doing whatever we can to support those out-of-pocket costs during this time, I think, is really important too.
Thanks, Erin. I mean, I think most patients everywhere, you know, have some access to telephone at least. So Dr. Ronald Zucker wants to know a little bit more about your telephone hotline, what kind of care is able to be provided there. You know, and I think this is just really an India only project at this point, but what lessons, in that case, what lessons are you learning from India that could potentially be applied to some other countries with a high incidence? I don't know, Nigeria, etc.
Yeah, thank you so much, Dr. Zucker. And yeah, we've been really excited about it. And it's funny you mentioned that, Hugh. We're actually in the process of getting ready to roll it out in Nigeria in particular. So we are looking at, exactly. Well, yeah, very high, you know, large population and significant need. But so this was, as I mentioned, kind of part of our GSK partnership, was one of the things we piloted together. And we have a helpline attendant who's really available all the time on this number, both in the office and then on her cell phone. Her name is Gompi. She's wonderful. She is, you know, both very organized and very smart, but also very compassionate, and a really great resource for families. So the hotline was developed. We hired her, obviously secured the hotline number, and then did a pretty big push. We've done a lot of awareness campaigns in India and around the world in the past through raising awareness about Cleft, about the fact that it is treatable, just things that you would assume everyone knows, and they really don't. So it was a combination of getting it out there through radio, billboards, posters, really doing everything we could. GSK has a network of like small pharmacy vendors. They work with a lot of different pharmacies across the country in small communities. So having posters in those types of kind of community health centers has been a really successful way to get the hotline out as well. And I think one of the unique parts of our partnership. So there was really a lot of work to get it out there. And now I think it's a number that's pretty well known. I think if someone with a child with a cleft came across a family that had one, they would probably feel comfortable or know to pass this number along. So and she gets a wide range of calls, people with other facial conditions or dental problems, and does her best to counsel them too. But she really registers cleft patients, works to understand their immediate needs. One of the other things I think that is challenging, sorry, Dr. Zucker, this is a very long answer to your relatively brief question, but one of the other things we know and are seeing exacerbated during this pandemic is people traveling when they shouldn't be to get care, and the risk and the burden that poses. So she does a great job counseling them, linking them up to the closest small trained partner hospital to them, getting them in touch with the right people so that they can really plan out their care. And she just continues to be a resource to them. So yeah, it's working really well, and we're excited to put the pieces into rolling it out in Nigeria next. We're just in the relatively early stages of that, but I think we hope to do it elsewhere as well.
Thanks, Erin. Thanks, Dr. Zucker. And when we talk about protocols that have been developed, I mean, for cleft teams, there's a lot of politics or bureaucracy to manage, right? So you have your country level protocols. You could have your funders protocols, whether that's Smile Train or somebody else. And there's even within a cleft environment, often the cleft team has to negotiate within the hospital, right? About even access to beds in times of COVID, of having ORs dedicated for something else, of reassigning staff. What would you say, or what have you been thinking about in terms of, as this pandemic continues to unroll, how that negotiation process happens of all these different stakeholders speaking into a situation of who gets care and who gets access to OR, and how cases of cleft, for example, get prioritized within the pandemic?
Yeah, it's an excellent question that definitely will try to answer, but can't. I mean, one of the things that we've really tried to do during this process, and that we always try to do, is respect the local systems. That's really our model. We don't want to be colonial. We have, safety and quality requirements to keep cleft care safe. Otherwise we won't support it. If it doesn't meet those, we'll work with partners to be able to meet them. But if treatments can't meet our requirements, we won't support them. But it's complicated. And I think as we see it's constantly evolving. I think one of the ways we've been maybe a bit successful, I think, in some countries is through advocacy that's been taking place, but then having cleft providers be leaders in their health systems. In the Philippines, for example, a number of our partners are, in leadership roles in the College of Surgeons. I think there's a lot that needs to be done on those local levels, and then within the hospital infrastructure to prioritize them. I think the other thing that we could probably do as a community is get more data out there about the impact of treatment, the impact of surgical treatment, the impact of speech treatment, ortho treatment, and really show how essential these treatments are and how essential they are at the optimal times. Because I think that's the data that we really need, and to get into the hands of the leadership at these country levels too, so they can understand when they're making these decisions why there's a need to prioritize these cases.
Thank you, Erin. Well, you mentioned speech, and you know, as we know, speech therapists are often at the forefront, at least in the Cleft community, of driving telehealth in this new era. Dr. Debbie Sell from London, UK's question is, can you talk a little bit more about the workforce to deliver speech therapy through telehealth within the Smile Train network?
Yep, absolutely. We've been doing so much to try and build up this workforce because it's essential. You know, you can have a series of surgeries on a child, as you all know, and without, in some cases, proper speech therapy, they're not going to realize, you know, the benefits of those surgeries. We've been doing a lot in this space. I think a couple of our speech therapy partners, I thought I saw Mirza and Savita on the call. So we certainly are trying to elevate leaders that we have in countries. We're really expanding our medical leadership councils to include speech therapy and to make sure that we have speech as you know, having a key voice at the table, and make sure that we're considering the role for speech in everything we do. That's really been an evolution for our organization over the past several years. And we've also expanded the investments we're making in speech, and that not only includes treatment, but training. So we're certainly looking, we've been working with Kate Crowley at Teachers College to do quite a lot of training across the African continent with our partners and leaders in the space to try and build up that capacity. The work that we're doing, especially in really low resource places like Africa, often involves some task shifting or training of health providers that may not have the same level of speech training that you know, Savita or yourself or others have. So we have pretty strict testing requirements, and then additionally quality assurance requirements when we assess the quality of speech that's being delivered. I think we're looking and hoping to invest quite a bit more in more formal speech training programs, especially in places where they may not exist. We've been doing some twinning, for want of a better word, to support you know, speech therapists from places where there may be fewer resources with those that have more. We're making virtual resources available. So we're really trying to do a lot. Oh, and Savita just responded, in India, we've conducted training programs for SLPs across ST centers during this pandemic. Teletherapy is commenced in most centers. So again, using those leaders. And I know the work that Savita is talking about has not just been, I don't think just across India, but globally too. You know, where we have strength, we're trying to use it to build strength elsewhere. But we're trying to do it in a really responsible way, and to make sure that we are tracking outcomes so that we can you know, make sure the quality of the treatments that are being given are strong.
Thanks, Erin. And I think that's a topic we probably will need to keep coming back to in the new year, is the idea of how to track outcomes. You know, as we're all partners are trying out new and innovative techniques, and I heard that strongly through your presentation, you know, how do we keep documenting, trying to learn from, sharing some of these good practices so that it can really inform in an evidence-based way our approach going forward. So thanks, Savita, and thanks, Erin, for that answer. Colleagues, our hour is almost up. It's flown by. Thank you, Erin, for leaving so much time for us to be able to chat and to ask some of the questions and thinking through this content for each of our regions, both within Smile Train networks and beyond. As you see, there's lots of different charity partners available on this call. What's coming up next, very briefly. So we will continue some of these questions. If you do want to know how to join Slack, send us an email at info@cleftcircle.org. We'll get you set up. It can be a way to test out some of these ideas or access to some of these papers as they come up. And sometimes it's not even a question of just creating something new. Sometimes within some of the partner networks or in Smile Train's website, there are some things that are there that we don't all know about. So it's a great chance just to highlight some of the excellent work that's being done as this pandemic continues to unfold. Coming up next, we do have a really exciting webinar. So, and Erin, you're going to be back again. You know, this is a repeat performance.
I know. Only for, I think I'll only talk for 2 minutes probably.
That's great. We're delighted to have you. So the World Cleft Coalition is a movement that emerged out of Cleft 2017 in India, out of the Chennai conference, as a way of working together to really articulate some of these international treatment standards that can guide some of our work, and also the organizations that are not part of the COCP to really put that out there. So we'll have Dr. Ruben Alaya, Gareth, Usama, Serena, Dr. Jamie Perry, and then Erin will be back. So don't miss this. Next month, December 10th, same time as we've had today, we'll be talking a little bit more about this in terms of the papers that have been published and some of the presentations that have been given, so we can update all of you. And again, thinking through how some of these treatment standards apply to your own context, especially within a pandemic. So please feel free to come back very soon. We're delighted to have you. Thanks for making such a great outcome today of so many people joining us. Erin, thanks for your presentation. It was fantastic. We will be posting it to YouTube and to our Slack channel shortly. So especially if some of your colleagues for whom English is not their first language, I know it can be a lot easier to view these afterwards. So they will be available, and we encourage you to make reference and make use of those going forward. Thank you, everybody. And a special thanks to Erin.
Yeah, thank you, Hugh, for this fantastic community and opportunity. It's really, really wonderful. Thanks to Transforming Faces.